Hello, guys. This is Dr. Bailey, Dr. Bailey's Evolved. Sorry, running a few minutes behind where I typically like to get on a little bit early, but clinic ran a little bit long today. Um, Kind of an interesting topic, not a very long topic, I don't think, but um, we're in the middle of renewals for both Arkansas and Oklahoma currently. And anytime I start talking about doing lives or going over things, I always listen to what patients have to say during their appointments and then make sure that I try to address that because usually, if you've heard the old saying, if one person or one patient has that thought process, well, then likely others do. Hey, Mr. Edgerton, how you doing, sir? And so, one thing that is consistently brought up is paranoia and panic. And I can't tell you how many patients when they're doing the renewal and I'm sitting there talking to them like, okay, hey, you know, um, have you been getting benefits? And if you are in the cannabis programs, what are they? And then what are your negatives? And inevitably, the negative is, well, I've kind of had to figure out which kinds make me kind of anxious and panicked and paranoid and all those. Hey, Miss Sheehan, how you doing, ma'am? And so what we notice, and it's the industry's fault in general. It's the dispensary's fault in general. And I don't say that in a hateful, mean manner, but it's the truth. You see it all the time where that fire flower is, or that flower with the super high THC percentages. And a lot of it we know is BS. I mean, you're seeing THC percentages over 27, 28, 29%. You know, it's probably not the most accurate. Um, and so what we see is, you walk into the dispensary, if you got a young or even older button that doesn't know a lot about cannabis and say, hey man, this flower is great. Well, that there are some folks that do really well with it, but what we know is the THC, especially THC delta 9, crosses the blood-brain barrier, and it actually triggers and lands on the amygdala. Horrible pronunciation. And so that's the center of the brain that controls like fear primarily. We know that in brain surgery or after stroke, I used to work in the Neurostroke Institute at Hillcrest, and we see that you see that in patients that have had a pretty large stroke and it affects the amygdala. They are, hey, Mr. Leach, how you doing, sir? They don't recognize fear. They can recognize facial emotions. They can recognize a lot of different feelings and whatnot, but they don't understand or recognize fear anymore. And so, hey, Mr. Pre. And so, what we see is that with these high THC flowers or vapes or even edibles, and distillate can do the same thing, can all lead to this feeling of panic and paranoia. And usually, when I'm talking to a new patient or a cannabis naive patient, the way I break it down is I think we've all seen these videos or movies of like the frat guys or the sorority girls that sneak off to go smoke weed and they get panicked or paranoid or freaked out. And what it typically is a lot of black market cannabis, especially black market cannabis, but in general, a lot of it is sativa dominant and it's high in THC content. So it is something you have to look at. Now, is it all THC across the board? No. There's actually been some really cool studies with NIH and some other areas on injecting THC levels into the bloodstream and then monitoring the response and activity in those parts of the brain. And we've seen there was a large group that had no experience of paranoia and whatnot at 7.5 milligrams of THCV. But when they hit 15, absolutely started having this pretty significant paranoia and panic. Now, there is some correlation with that with underlying issues. And, a lot of times when I talk to my PTSD patients or my patients that are overly anxious and have a history of panic attacks, typically tell them to avoid the higher THC level flower or vapes or whatever product they may be using because of that. If you're trying to avoid medications and symptoms and whatnot, hey, Mr. Brooks, how you doing? um, it's an issue that we want you to get the most out of a cannabis program. That's what it comes down to. And when my average patient right now, which I've got a lot of renewals, I'm not gonna lie, right now is a very high renewal time frame, and it's gonna be like that for probably the next 8 to 10 months once we get through the bulk of the renewal phase, and then the next 2 years it'll kind of calm, slow back down, and then pick up depending on politics and all that. But the number one thing I hear from a lot of my newer patients, especially, is, well, I just don't really want to get high, but I want this or that benefit. And so I think from an industry perspective, and I think a lot of the dispensaries, especially, are going to have to really look into the bud tenders that they're hiring, how they're pushing what I hate to say product, but how they're sales products, their cannabis products, and what cannabis products are keeping in selection. And it's also going to fall on the growers and processors a little bit because for the longest time, it was almost impossible to find an indica dominant variety strains in Oklahoma. It was almost everything sativa dominant. And so a lot of, there was a lot of patients that quit the program initially and then came back to it because of the fact there just wasn't that there. And it was directed at a certain group of the patient population. All right. Oh, thank you, Miss Sala. Again, guys, share this video out. I'm all about providing as much information as possible. So the more people that we can educate on stuff and kind of walk through those things, and it's definitely something that I want to try to do. Um, so another thing that I wanted, and what we're talking about today, is the paranoia and anxiety and panic that can go along with high THC flower or in general just cannabis products. Something that is kind of interesting that we've learned is that there is a difference in females to males. And why is that important? Well, it correlates with estrogen levels, and this is one of those things that's going to be really cool to kind of watch over time as far as as research becomes available. Women typically hold on to cannabis and have a sensitivity to THC, especially THC delta 9, that's almost 30% higher than men. Why, we don't know. But that also can lead to that much easier tipping point of what we're talking about, of the paranoia, panic, and those types of issues that go along with that. Um, it is something that we're going to have to look at big time at testing. When I talk to patients and we're doing renewals and some things where, if we've had to add a medication in the past year in Arkansas or the past 2 years in Oklahoma, why? I'm always curious as to why. And inevitably, what we're finding out, the number one thing that I've heard patients say they've added medications for, excuse me, is anxiety or panic. And then, so my next follow-up question is usually, hey, so what are you using cannabis wise? And that's when we start to dig into it. And it's usually a sativa dominant hybrid of some sort, or a distillate produced edible that's high in THC, and sometimes they're using it during the morning or day for that boost of energy. But on the flip side of it, is it mysteries? Is it because of the fact that it is um, needed from the energy perspective, or is it needed because of the better feeling, especially if you're depressed, have those issues going on? But then, on the flip side of it, we're having to add a medication to combat that. That's kind of like taking a high dose of Adderall and then chasing it with Ambien in the evening because you can't sleep. So, really, 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 my hopes for the program is that that the dispensaries get a little bit better in how they're educating their staff, and then how staff interacts with patients, and then from there, testing has to be huge, because I've had a bunch of my family members and close people I know that go to the dispensary and they'll say, hey, what do you recommend? And I'll send them in to grab something, come out, and they'll swing by, or I'll sit and talk with them, and I'm looking at the labeling, and it's literally non-existent. It says 20 milligrams of THC per serving, but it doesn't say what endocannabinoid it is. Is it THCV? Is it delta 8, delta 9? What is it? And so that is something that we're really going to have to work on as an industry. And my hope is that that's something that Ron Durbin and some of these other guys that are way more intelligent than me in the legality side of things is really starting to push with some of the legislation, because we don't want negatives, right? There's enough of a stigma out there. The way I've learned to look at it is state of California has had cannabis for 20 some years. And these kids on YouTube, or and adults on YouTube, have been chasing Darwin in California for decades, and they haven't been able to catch them with pure cannabis. Now they can chase it with other ecstasy or whatever else and hurt themselves, but cannabis they can't. And so, that is the viewpoint I try to give a lot of folks in the industry or outside the industry looking in. And so, what we really want to try to do is focus on the positives. Can we decrease medications? Absolutely. Do we have a risk factor there? Not really. And that is a big selling point. The last thing I want to do is have a patient have a cannabis license walk into an emergency department because they're having a panic attack because they got a hold of some super high end sativa flower that they probably had no business playing with, or being sold. And it was just, I don't want to say ignorance, but it was just lack of knowledge in the cannabis realm. And then when you have bud tenders that don't understand and they push that product because it's their fire flower or it's their top shelf flower or whatever that may be, it causes issues. Because I can tell you inevitably, no matter how much I argue with an ER doc or a mini doc or whoever, it's going to go in the chart as a cannabis use disorder or something along those lines, which just further smashes the stigma. I had a long discussion with the Arkansas Medical Board on like earlier October, is the first week of October, and what I found really quickly with every physician, just about every physician on that board, not all, but just about every physician, is they don't agree with it, don't care about it, don't want to know anything about it, have no interest in educating themselves on it. They have what their thought processes are on it. And so that's why it's so important to try to push the positivity here, and do everything we can to have the most positive outcomes. And so again, the whole point of today was just to talk a little bit about flower, or not just flower, but that seems to be the common thread. High THC percentage flowers and the incidents that we're having on paranoia and panic and anxiety in some of our patients. PTSD is like the number two reason for cannabis licensure across the United States, not just Oklahoma or Arkansas or anywhere else. And so that is a huge thing when you start thinking about the last thing we want is somebody that's had suffering from PTSD, especially my veterans, having an anxiety or panic or paranoia that's unfounded. That's when bad things happen. So we really all need to work together on trying to educate on this, not just THC percentage, and it's not just THC. What compound actually is it? I think there's so much there. I do want to do some more research into the terpenes. I didn't see a whole lot of terpene discussion when it came to paranoia and panic. Almost everything was correlated to the THC compound, and I know partly why. You have what's called the blood-brain barrier. And the blood brain barrier is what makes treating neurologic diseases and especially infections like meningitis incredibly hard because we don't have medications. There's only a handful that cross that barrier and can actually kill the infection, which is why when you hear about, I think that here in Oklahoma, it was, I don't know, 18 years ago, I think it was up north at like Ulaga or Talala, they had breakout of meningitis that there were several children that lost arms and stuff. And I think what happened was they were getting water from a well or something like that. But that's why in THC, we know THCV, THC delta 8, especially THC delta 9, crosses that blood brain barrier, interacts with the receptors, the CB1 receptors, all through the nervous system and especially around the central nervous system. So that's why that research is there, and that's why there wasn't a whole lot on terps. Terps are typically fats. In long story short, and so they don't always cross over there. Appreciate you, Mr. Overstreet. Let's see here. Mr. Holman, most of these indica are hybrid, anxiety and depression, use it throughout the day, and I've had any anxiety because budtender did not know the product. That's absolutely right. And so, guys, in Arkansas, it's a little bit different. So, my Arkansas folks, take this with a little bit of a grain of salt because you guys really are kind of getting hosed in that realm because of the fact there's just not a lot of dispensaries. You guys have like 20 in the entire state. We're at hundreds and 100 plus in Tulsa Metro. In Oklahoma, though, as a patient, y'all, when you walk, and I say this, and someday am I going to open a dispensary? I'm going to tell everybody right now, yes, someday in the future I'll open a dispensary because there's some ideas that I have that I think can make it be done correctly. And I think that we could really help the average, what I consider medical patient. But in Oklahoma, if you walk into a dispensary and that bud tender does not know what they're talking about and you don't feel 100% comfortable, go to the next one. Make them earn their business. Make them earn that education that they should be having to provide you with a medication, to provide you with what you need to have that quality of life that we're all looking for. That's the whole point of the program. And so I think you got to put pressure on the dispensaries to do the right things. They're getting hit hard right now, and I understand it from a business owning perspective. But on the flip side of it, if you're going to open a business in a medical area, which right, wrong, or indifferent, I don't care what your views are, cannabis is a medical area. You got to take the time to educate yourself. Because I'm gonna put you on the same level playing field as doctors, as nurses, as nurse practitioners, PAs. I don't care who, but a pharmacist. But on the flip side of it, if you're gonna do that, you really got to take time to educate yourself. And there's a lot of ways to do that. Lots and lots of ways to do it. Several of us are available to try to help out folks as much as possible. I can tell you right now, I send patients to dispensaries throughout the city of Tulsa, especially in the city of Tulsa, that I've had good response back from patients, not from me personally. I can tell you I've gone into some dispensaries, but for the most part, I'll send a family member into the dispensary and say, hey, how did they treat you? Were they able to answer your questions? And so to prevent stuff like where this panic and paranoia that's happening with some, especially, don't take this the wrong way, my younger patients, but my older patients, my patients over the age of 50, that's the patient I'm concerned about, because that's the patient that typically, especially as a new patient, when they come to me, they're like, hey, the number one thing out of their mouth is, I want some benefit here, but I don't want to be high. They can get ran off really, really quickly. Hey, Miss Livingston, hope everything's doing well. Um, that's kind of my big things for today, guys. I don't like to drag these on too often much. I wanted to be informative though. So if there's stuff that you guys are curious about again, and you're going to hear me say this every single Monday, hit me up, let me know. Shoot us a message, respond to this comment. I try to read through the comments and get through all of them. Make sure that if you're commenting on the original video, because this video gets shared out a lot and I don't see all the shared. If we're not tagged in it, I don't necessarily see where all it's shared. So I can't necessarily respond to those comments. But if you comment on the actual video, I try to always make sure I scroll back through and get everybody taken care of. If there's anything that you need from a medical perspective that you want to know about, doesn't have to be cannabis related. One of the things that I'm probably going to be doing in the near future. So I preach all the time about exercise and diet and water and health and wellness and all that other stuff. Life happens to every single one of us. I fought October 24th. October 24th, I was probably in the best shape I've ever been in my life. I'm running 5K in 18 minutes. I mean, I was lifting heavy weights. I was in phenomenal shape, almost 40 years old. Then I took a vacation, came home, caught COVID. And also during that fight, blew my knee up. I met with a surgeon on Friday. I have to go have reconstructive surgery sometime between Christmas and New Year's. And so right now I can't do anything. I can work out upper body stuff. He said I could ride a bike, so that was about it. Which if you know me, that's real hard for me. And so I'm probably going to kind of document a little bit about my surgery, my recovery, what I do, because there's a lot of folks that happens. We get hit up with injuries, or we get in a car wreck and we have something bad happen to us and it derails the hell out of us, all of us. You know, mine is no different than anybody else. So I want to make sure that everybody's aware. Hey, if I'm going to tell you this, I'm going to do the same thing myself. So I'll track everything. I'll show everybody. Hopefully, we're going to have some new news about a new product that we're coming out with as well, that I'm going to be able to hopefully kind of highlight with that, with some partners that we're talking with. Again, though, if there's something that I can do to help, shoot me a message, let me know. Look on your licenses. Make sure that you're checking your licenses 2 months out, so that you can book your appointment a month out. You cannot start your renewal for your cannabis license here within 30 days. Again, actually had a talk with the head of patient coordination and care for the OMMA the other day. It's the big issue we're coming across is the dates. I had 5 of them this morning when I logged in at 6 a.m. to start returning work emails. So for today's date, say you happen to have gotten a recommendation today and you're doing your renewal application, it's going to ask you for date of physician signature. It's 11-23-2020. You got to put 2020 on there, or the state is kicking it back. Now, the state is aware of that. Like I said, we had a discussion about it. They're going to try to start looking through and fixing that, but they have to fix the whole website where you type the information in. So that is something that's kind of come along. Share that information out just for if you know somebody doing the application. Let me see here real quick. Jimmy Coffin. My wife's having a hard time getting the right cannabis. She's off for several years NX use now. After about a year, she has anxiety. Let's see here. Panic attacks, depression, bad. Just try to help, but it's hit and miss. And so, Jimmy, the big thing to remember is keep a journal. I've got one that I keep here. But if you keep a journal about the products that you use, the terps, the terpene profiles, the endocannabinoid content, he's using indicas, which is a good start. But what is the dominance of that indica? Is it more CBD? Is it more CBG? CBG can kind of give you a little bit of energy sometimes. Is it CBN dominant, which would be very calming and relaxing, maybe too much so for the day. So keep a real good close on what idea and look at what they're using. The other thing is, unfortunately, we're not having good, reproducibility and testing. And so some of the dispensaries are getting product that I'm not 100% sure is the product that it was intended to be sold to them, maybe. Um, and so that is something that we're going to have to kind of play with and see. But a journal, I know that kind of sounds cliche, and there's actually several apps. Sorry, I'm updating my phone right now, or else I would um, I show everybody that. But there are several apps that you can get that will actually help you track your the strain uses and what types and how you've used it in the past. That's a big deal because if you just walk in and you continually say, "Hey, I want something for pain," but you don't ever tell them, and every time you're not getting your pain resolved, and you're just starting over from scratch every single time. So when you go in and tell them, listen, I want some for pain, and I've tried this strain or variety of indica previously and didn't get any response, or got some response, or maybe it's too sleepy, I need something for daytime use, and that's when you start really looking at those things. Again, there is some education and stuff. One-to-one stuff could be okay, Mr. Holman. The only thing I would be cautious again is if she's having panic and paranoia, it depends on what that one-to-one is, right? If it's THCV, is it THC delta 8, delta 9, whatever it may be. THCV can also cause a little bit of panic and paranoia too. And not nearly to the degree of delta 9, but it definitely can. So I would lean something that's much more CBD and indica dominant and heavy than the other direction. Yep. All right, y'all. Again, share this video out. Invite people to like the page. The more people we reach, the better. I'm all about trying to grow the industry in the area, especially from a medical perspective. I'm not really in the industry, I guess. Hopefully that'll change in the near future because there's, like I said, some things I'd like to see differently done with dispensaries and whatnot, but we'll see. Right now, I'm more than happy just running the clinic and seeing patients. So if there's anything I can help with, let me know. If you've got some issues, medical issues you're curious about, let me know. We can talk about them. We've talked about hypertension, we talked about weight, we talked about diabetes. I mean, I can hit on a bunch of different topics and help out, at least with what I know medically. It's something that I take a lot of pride in and trying to make sure and help as many people as possible. Um, what else? What else? What else? Hadn't really said much yet. Um, we are going to do something for Christmas. I will be looking for some, I'd say the word needy families, but some families that could benefit from some help around Christmas time. If that's something that you know of, and I say that I want to make sure that they're the legit folks that are struggling. If that's the case, message the Facebook page, the Evolve page. Let me know. I've got some things I want to put together to see if we can't help out some folks, and we're in the Broken Arrow area, but I mean anywhere in the state of Oklahoma. I'm all about trying to help folks out. So whether it doesn't matter, previously with the fight, we did a big veteran donation, and it doesn't have to be veterans though. It can be anybody, old, young, small, new. I don't care. Message the page, let me know. Reach out to my personal Facebook page, the B Bailey Dio, or the Dr. Bailey's Evolved Health and Wellness. Let me know kind of what you're thinking and who you're thinking about and why. That's the big thing. I want to know why. What makes them deserving? And that's definitely not to be a judgmental thing, but it's going to how I'm going to help kind of break down who we're helping and why and what we're doing. So by all means, let me know. I hope everybody has a great Thanksgiving holiday. I hope everybody had a great weekend, and we'll talk to you guys here next Monday.